Welcome to Be Stronger, Live Longer's two-part interview with Dr. Cameron Borody. Today we'll be discussing lower back pain. In part 1, Dr. Borody will identify the different types of lower back pain. He'll also let you know when it's important to seek treatment and medical advice. Stay tuned for part 2 in this series, in which we will discuss practical advice for exercises, rest, and stretching for the different types of lower back pain. Cam, what are the most common causes of lower back pain?
Well, Chris, there are 3 general causes or categories of lower back pain that affect the active population. The first is the pretty well-known discogenic pain that could be related to a bulging disc or an actual disc herniation. The second category is perhaps the most common amongst a younger group of patients, and this would be a mechanical lower back pain, which could involve any combination of injury or irritation to the muscles, joints, and ligaments that are involved in the lower back or lumbar region. The third type of lower back pain is unfortunately the age-related degenerative disc disease.
Can you tell us what degenerative disc disease is?
Sure, Chris. Degenerative disc disease is basically wear and tear of your lumbar spine. It can affect other regions of the spine as well, but when we're talking about the lower back, it's usually a result of a lifetime of exposures to different stresses and different activities. Essentially, it leads to narrowing of the disc spaces, which results in more force and stress being experienced by the vertebral bodies and the facet joints in the back of the spine. Most patients will experience stiffness in the morning, achiness, difficulty loosening up, and it can have a significant impact on your ability to enjoy the activities of daily living.
What is discogenic pain?
Well, Chris, disc pain or discogenic pain is back pain that emanates from some sort of problem with the actual disc itself. Intervertebral discs are gelatinous structures that serve to separate and space the vertebral bodies themselves. Because they're gelatinous, they allow for motion in multiple planes. As a result of a career of sitting, incidents or multiple repetitions of heavy lifting and twisting can cause damage to the discs. They can bulge or even herniate and ultimately put pressure on the spinal cord or nerve roots that can cause pain not only in the lower back, but into the buttocks and thigh and calf. This is more commonly known as sciatica.
You've also mentioned mechanical back pain. What is that?
Well, Chris, mechanical lower back pain is pain from various sources in the lower back. It tends to be caused from injury or inflammation of soft tissues such as muscles, tendons, and ligaments, as well as potential irritation of some of the joints of the lower back that not as many people are familiar with as discs. These are the joints in the back that are known as facet joints.
If I'm experiencing back pain, what are some of the signs and symptoms that indicate a trip to the doctor or chiropractor is warranted?
Well, Chris, you might consider getting an accurate diagnosis regardless of the type of lower back pain you're having in order to make sure it's not anything more serious and get the best advice possible to deal with it as quickly as possible. Having said that, if your back pain is lasting for longer than a few days, isn't getting better, or is substantially worse, you should certainly see a professional and get a diagnosis. Things like weakness into the legs, numbness or tingling, loss of coordination or control are yellow or red flags that should certainly signal you should get some medical attention.
If I have back pain, should I be exercising or should I completely rest my back?
Rest is a dirty word in sports medicine. Relative rest is okay. That might mean you don't go for a run or you avoid deadlifting that day, but there certainly are some exercises that would most likely be helpful for your back, almost regardless of the type of injury or condition you're suffering from.
If I hurt my back, should I exercise through the pain?
Definitely not. You should always let pain be your guide when you have any sort of condition or injury that you're trying to work through. I think the key term is probably relative rest. You want to avoid aggravating your condition or injury further, but at the same time, most lower back conditions or injuries are best treated with a variety of different exercises and mobilizations as opposed to resting completely. There are specific exercises which will be most effective at helping you recover from your back injury, as well as improving your overall fitness to prevent further injuries from occurring.
How do I know what the best exercises are for my back?
Come and see us for our expert advice and an appropriate exercise and/or rehabilitation program.